our lecture of acute glomerulonephritis, and today we will discuss what are the complications that can occur with acute glomerulonephritis. Since this infection causes very severe inflammation in the kidney, as a result of which the kidney can rapidly go into shutdown and the patient can present with the acute renal failure. There is a risk of acute renal failure, which is one of the complications of acute glomerulonephritis, and because of acute renal failure the patient might need dialysis in that case, since all the function of kidney can undergo shutdown and that requires sometimes dialysis. So it is one of the very severe complications of acute glomerulonephritis, and because the kidneys are shut down, the effect of this will be on other organs as well. For example, when the kidney undergoes shutdown, there is sudden rise in blood pressure, and this blood pressure not only affects our brain and it can also affect also our heart. So in the brain it can cause hypertensive encephalopathy. This is the another very deadly complication of acute glomerulonephritis, that is it can cause hypertensive encephalopathy, and also it can cause left ventricular failure. So this occurs because of the sudden shutdown of the kidney. So there are complications because of the shutdown of the kidney. There is rise in blood pressure, and this blood pressure damages our brain tissue and also damages the heart, and it can cause left ventricular failure, hypertensive encephalopathy also. Some other complication of acute glomerulonephritis, since it is acute, it can go, if it remains for a long period of time, it can go into chronic glomerulonephritis. So this is also one of the complications of acute glomerulonephritis, that is it can go into chronic glomerulonephritis. Besides these complications, there are some other complications. For example, the function of kidney, if it undergoes shutdown, there is start build up fluid in the body and there is risk of fluid overload. So it is also the complication of kidney, that patient can go in acute fluid overload. Besides this, there are also some electrolyte changes, like there is retention of potassium inside the body, and this potassium is toxic for the body. It can cause arrhythmia and sudden death also sometimes. So these are some of the complications of acute glomerulonephritis. Now we'll see what are the tests we can do to diagnose this case of acute glomerulonephritis. There are certain blood tests which we can do and certain investigations which we can do. Now we will see how we will diagnose a case of acute glomerulonephritis. So what are the investigations that we can do? We can do investigations like, the first of all, the very important investigation is urine examination. So on naked examination of this patient, of the urine of this patient, there will be smoky urine. So we can see the smoky urine in a case of acute glomerulonephritis, and this smoky urine occurs because of the loss of protein, and the protein loss is less than 3 gram per day. And the protein loss, that is the proteinuria which occur, it is less than 3 gram, and it is called as the nephritic range proteinuria. So nephritic range proteinuria, if the proteinuria is more than 3 gram, then it is the nephrotic range, then this proteinuria is nephrotic range. And for this there are some other causes of nephrotic range proteinuria. So our case is the nephritic range proteinuria, that is we can see the protein loss in their kidney, and this protein loss is very less, that is less than 3 gram. Besides this, one of the very diagnostic feature in the urine is the RBC cast. We will find the RBC cast. What happens, the RBCs, as they pass through the kidney, the RBCs clump together and they assume the shape of the tubule and they form the cast, and this cast is known as the RBC cast, which is the diagnostic feature of acute glomerulonephritis. So highlight this word, this is the RBC cast on the urine examination we can see. So there are few things on the urine examination. We find the smoky urine, there will be protein loss, and there will be RBC cast as well. So this is important, and the cultures are usually negative. Sterile culture, this is also important, the cultures are negative. So if we send the cultures of the patient of acute glomerulonephritis, the cultures will be sterile. We don't find anything in the culture of these patients. Then we can also do certain blood work. What are the blood tests which we can do? We will now see the blood test. What are the blood tests we can do to diagnose the acute glomerulonephritis? First of all, we will do the CBC. In the CBC, we will find the anemia, and this anemia occurs because the fluid is a lot of fluid inside the body, which cause the dilution of the hemoglobin, and this is hemodilution. So anemia occurs because of the hemodilution, and as the anemia occurs, it ultimately lead to the rise in ES, erythrocyte sedimentation rate. So we will find the anemia, we will find the erythrocyte sedimentation rate, and also because there is an infection by the streptococcal bacteria, so we will find there is rise of WBCs inside the body. Besides this, we can also do certain tests to diagnose the infection by streptococcal, and we can do the test, and this test is known as the anti-streptolysin O titers. We can do to diagnose the streptococcal bacteria, and it will be raised. Anti-streptolysin O titer will be raised. So this is also very important. Besides this, there is hypocomplementemia, that is C3 and C4 level will be reduced. These complement levels ultimately they are in the blood, and whenever the bacteria, that is streptococcal bacteria, and the antigen antibody reaction, whenever they occur, this complement jump into these areas where this antigen antibody reaction is occurring, and as a result of which their levels falls inside the circulation. So we will find the hypocomplementemia also in the blood work. Besides this, we can see that in the kidney function test there will be derangement. That is urea and creatinine will be raised because kidneys are involved. The urea and creatinine will be raised in this patient. And as we go for the lipid profile is essentially normal, and this is very important because if we find the lipid derangement, that is the lipid is increased inside the body, then that favors our nephrotic syndrome. Nephrotic syndrome will more likely if lipids are raised, and this occurs because in nephrotic syndrome there is lot of lipid are lost from the urine. There is lipid uria, and this lipid uria ultimately send the feedback to the body to produce more lipid, and there will be more lipid in a case of nephrotic syndrome. But this is not true with our case, that is acute glomerulonephritis. The lipids will essentially be normal. Then we can also do certain tests, radio imaging. For example, we can do the x-ray. What we'll find in the x-ray, since the x-ray, because of the kidney is damaged, and the damage of kidney will ultimately affect our heart, because kidney damage lead to the increased blood pressure. This blood pressure will affect the heart, and we can find the cardiac enlargement because of the hypertrophy. There will be cardiac enlargement. We'll find the cardiac shadow will be enlarged, and also because sometimes this heart can fail, and it will ultimately cause the fluid overload to our lungs, and on the x-ray we can find the pulmonary congestion, signs of pulmonary congestion. So radiologically, in a case of acute glomerulonephritis, we will find the enlarged cardiac shadow and the signs of pulmonary congestion on radiography. Besides this, we can also do throat swab to find the bacteria. We can do the throat swab to find the streptococcal bacteria which cause this infection. Streptococcal bacteria. Besides this, we can do some other tests to diagnose some other causes of acute glomerulonephritis. For example, we can do blood test to diagnose hepatitis B antigen, to diagnose hepatitis C, that is we can do the anti-HCV, hepatitis B, C, and we can also do the autoimmune disease by doing the test like anti-nuclear antibody testing. So these are the other tests to diagnose some other causes for acute glomerulonephritis. Then we can also do the ultrasonography. In ultrasonography, we usually find the normal kidney size. In ultrasound, we either find the normal kidney or increased kidney size in a case of acute glomerulonephritis. But if it is the chronic glomerulonephritis, the kidney size will be reduced kidney size. In a case of chronic glomerulonephritis, that is the complication of acute glomerulonephritis. Now, after discussing this blood test for acute glomerulonephritis, now we will see how we'll treat this patient. Now we will treat what is the treatment of acute glomerulonephritis. So we'll discuss the treatment. So for the treatment part, first of all, we will advise the strict bed rest to the patient until the edema subsides. We will advise the strict bed rest until the edema subsides, until the BP come down, until the blood which is losing through urine, that is the hematuria, it resolves. So the patient clinical condition improves. Until that, we advise patient the bed rest. Besides this, we will ask the patient to reduce the protein in the diet and to increase the carbohydrate in the diet. Besides this, we can also advise patient the fluid restriction. We will advise to the patient. This fluid restriction we calculate. We first ask the patient what is the 24-hour urine output. Say for example, the 24-hour urine output of the patient is 1000 ml, and we will add 500 ml to that, and that becomes 1.5 liter. And then we advise that the fluid restriction should be less than 1.5 liter. So we advise the fluid restriction in this way. Then beside this, we can also give certain drugs to reduce the fluid which is inside the body. We can give the diuretics to the patient. The diuretics, we have the furosemide, that is the 40 mg tablet we can give to the patient to reduce the edema and the blood pressure also. Besides this, we can also give the antihypertensive medication like calcium channel blockers like nifedipine, amlodipine. We can also give patient the hydralazine and diazoxide to the patient. Then we have to treat the infection. Also. For treating the infection, we have the injection of penicillin, that is the crystalline penicillin. We can give, it is the 5 lakh unit IM BD dose. It is given in the morning and the evening, that is the BD dose, and it has to be given either crystalline penicillin, or we can also give the erythromycin, that is 250 mg, and it has to be given 4 times a day, and this has to be continued for a period of 7 to 10 days. That is the penicillin and the erythromycin for treating the acute streptococcal infection which is occurring in this patient. Besides this, we can also treat the complication. For example, we will treat the treatment of complication, like we will treat the acute left ventricular failure, we will treat the hypertensive encephalopathy, we will treat the underlying infection as we already discussed. Then if still the patient undergo acute renal failure, and because of acute renal failure the patient will be having fluid retention, patient will be having high potassium, and in that case we might require dialysis. In later stages we might need dialysis in that case, if there is a sudden shutdown of kidneys, if there is severe fluid retention and the potassium levels start built up inside the body. Besides this, we don't use steroid. This is important. Steroid has no role. We don't use steroid. We don't use cytotoxic drug. We don't use steroid. So this is also important. So this is how we treat the acute glomerulonephritis. This is all for today. I hope you like it. If you do like, please do subscribe.